main takeaway of this paper is that now that coaching for physicians is on the map and is being used fairly widely with good results, we realize that we need to have standardized metrics that help us understand the competency of those who coach physicians. There's an excellent foundation through the International Coaching Federation, but it doesn't address the unique issues that physicians face, the mindset that physicians have, the complexities of the current healthcare environment. And we believe that that was critically important. My name is Dr. Gail Gazelle. I'm an assistant professor at Harvard Medical School. I am a master certified coach through the International Coaching Federation, and I've coached well over 500 physicians and physician leaders over the last 13 years. And I'm one of the lead authors on the paper, Competencies for Those Who Coach Physicians, a modified Delphi study. This article will appear in the May issue of the Mayo Clinic Proceedings. Through the Delphi process that we utilized to develop these standardized competencies, we identified 128 competencies in 6 key areas. These include physician-specific coaching, understanding physicians and the healthcare context, career span and culture, coaching theory and science, diversity, equity, and inclusion, and other social dynamics, and well-being, burnout, as well as physician leadership. And with these 6 areas and using the modified Delphi approach, we found a concordance of 80 to 95% on these competencies, well above the threshold we established of 70%.
I'm Wes Schwab, a primary care physician who has practiced and held leadership positions in public, private, and large group practice settings. Medicine today is beset with tough challenges, such as the after effects of the pandemic, the consolidation of provider systems, and emerging technologies. Our training has not prepared us for the interdependence needed for today's practice, nor permitted a proper regard for our own well-being. And the result has been burnout and its many consequences. Your coach should be expected to help you retain and hone skills for productive, quality practice, to find supports in your environment and build your capacity for self-care and recover agency in your professional setting. We offer these competencies as a way of guaranteeing our work as coaches with you.
I'm Margaret Moore. I'm co-founder and chair of the Institute of Coaching based at McLean Hospital. I helped bring this idea and team together for this study a couple of years ago. After my first career in biotechnology, since 2000, I've been a coach trainer, author, and executive coach, mainly for physicians and also leaders. Separately, I'm working on the integration of health and well-being coaching services into medical practice. So I'm particularly interested in the intersection of great coaching and the healthcare system with many needs. I've witnessed firsthand as a coach the positive changes experienced by hundreds of physicians through both one-on-one and group coaching programs. In addition to noticeable improvements in well-being and professional development and leadership, coaching also helps doctors bring a positive coaching mindset to their teams and to their patients, which improves patient engagement and satisfaction. Our study brings new integrity and depth to physician coaching, which is much needed. It will help healthcare systems commit to physician coaching as an excellent intervention, both to improve physician well-being and patient care.
I'm Angela Passarelli, a faculty member at the Fuqua School of Business at Duke University and a board-certified executive coach. I served as the methodologist and lead author on the paper. It is our intention that the competencies we've identified in this project become a standard for the field to guide coach education and training specific to working with physicians. As the coaching industry permeates healthcare, pathways are needed to ensure that those who coach physicians have specialized training, skills, and credentials to work with this unique population. Our next step is raising awareness that such a compendium of competencies exists. We hope that it will serve as a guide for coach education initially, and potentially down the road, a foundation for certification or licensure. As a note, the full list of competencies is available as a supplement to the article, which is openly accessible to the public. We invite other scholars who are working in this space to build on our work as we together understand and refine the necessary competencies. As the competencies we've identified are based on consensus of expert opinion, they likely represent threshold knowledge needed to enter the field and don't necessarily differentiate excellent coaches from average. Additional behavioral research is needed to identify distinguishing competencies, which will be a next step in this line of research.
We encourage readers to take a deep dive, read the details, share this with your colleagues, and use this as a way of assessing and addressing and training for the competencies that are needed for those who coach physicians.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.